BirthRx is a proactive preventive program for pregnant women. We treat women at any point during their pregnancy if they need help, but also we have this BirthRx program, which is really meant to get women in to start working with us toward the beginning of their pregnancy. As early as they're ready, first trimester is great. You don't have to have a problem to come in for BirthRx, but during pregnancy, your body is changing every single day. So we know that you are going to be more likely to have things like back pain, pelvic pain, SI joint pain, maybe pelvic pressure or urinary leakage. The key is that we can move in ways that cause those things to get worse and become bigger problems that persist into postpartum, or we can learn how to move in ways that prevent a lot of those problems and reduce the risks with a lot of those problems. So exercise is amazing for people that are pregnant. There are lots of benefits of exercising while you're pregnant, and a lot of those benefits have to do with actually setting the stage for a better experience postpartum. So coming in early in your pregnancy is really important to get an assessment of how are you moving, how are you breathing, is anything bothering you, or is anything even looking like it's a little abnormal and could set you up in the next couple months to experience a problem? That's all what we're looking for throughout the BirthRx program. BirthRx typically goes from about first trimester into a few months postpartum, and it can vary a little bit for each woman, but the majority of patients who come in for BirthRx feel pretty good throughout all or most of their pregnancy. And usually I'll see them at a frequency of about once every 4 to 5 weeks. So for most athletic women, that's about a good amount of time to check in, see where they are in their current workout program, or just what they're doing at work, their daily movements. Are you experiencing any new pain? And we can help them learn to move in ways that can reduce that pain and treat that pain and allow them to keep working, keep moving, keep doing all the stuff that they have to do every day. And also, something important that physical therapists do is we help monitor for medical red flags. So we're not the same as your OB, but we're looking and listening and asking you questions every 4 or 5 weeks when we see you about your changes every week. We're monitoring your response to exercise. If anything doesn't sound or doesn't look like it's medically appropriate or could be a concern, we let you know that so that your doctor can know, maybe without having to wait to see them at your next OB appointment. Another thing BirthRx does that people seem to really appreciate from it is we focus a lot on pelvic floor mobility, hip mobility, and the biomechanical aspect of preparing you for labor and delivery. With labor and delivery, we want your pelvic floor to be able to move. We don't want it to be tight and tense so that when the baby is pushing through your birth canal, that's going to increase risk for perineal tears or laceration. We want you to be able to move your pelvic floor and be able to easily, comfortably get your hips into the positions needed on the day of delivery. All women can benefit from physical therapy during their pregnancy. If you are having pain or having symptoms, pregnancy is a much better time to start addressing those things rather than live with them for the duration of pregnancy, go through a labor and delivery process while you're having pelvic floor dysfunction, and then try to start at square one with rehabbing that in postpartum. Not to mention, you already have this whole new life with a baby to take care of that you're probably really focused on. The longer that we live with problems and experience symptoms, typically the worse they're going to get. So coming in during pregnancy is probably one of the best times to come in order to set yourself up for feeling good and effective movement in postpartum. We tend to have really good feedback with BirthRx. The majority of women that come in and do BirthRx are usually women that are either athletes, or maybe they're just very active people and they value being able to get out and move every day, or maybe they have a physical job, things that are really important that they're able to do throughout that duration of pregnancy. Most women will say that they are so relieved that they feel confident working out, and every workout is not this fear of, what could I cause? What am I making worse? Am I setting myself up poorly? Is it a problem if I feel this during exercise? Keep in mind, most guidelines that you get from your OB, because most pregnant women have an OB, the guidelines are going to be based off medical safety. That is very different than giving you advice on how to reduce your risk of a prolapse or leakage or back pain. That's a very separate topic from medical safety. So most women are told things like, don't overexert yourself, don't do anything where you could fall, don't go upside down during pregnancy. And that's all good, and that's good advice, but it does nothing to answer the questions of how do we prevent pelvic floor dysfunction. Most women are totally in the dark about that. So that's where pelvic PT can be also a very important provider for you during your pregnancy.